feels so much better. She's so much healthier.
Welcome to the BioNexus Health Podcast with Dr. Jodie Aide, who holds a PhD in Integrative Medicine, a doctorate in OT, specializing in neurology, is board certified in Integrative Pediatrics, an internationally recognized pioneering clinician, registered herbalist with the American Herbalist Guild, and author. Her naturopathic journey began when her son, who was diagnosed with autism, developed a series of traumatic, life-threatening chronic health issues. For over a decade, she's honed her skills to combine the ancient Ayurvedic healing practices with Western herbal medicine that has helped patients in over 50 countries and recovered her son, who is on his own journey towards becoming a physician. And now here's your host of BioNexus Health Podcast, Dr. Jodie Aide.
Hello and welcome again to BioNexus Health Podcast series, Autism Uprooted. Today we have with us Michael, a decorated veteran of the U.S. Armed Forces, and his lovely wife, Maria. They have very generously agreed to share with us the journey that they've been on with their beautiful little girl diagnosed with autism spectrum disorder. Welcome, Michael and Maria. Thank you for being here today.
Yes, thank you for having us.
Yeah. So
let's get started with one question that's right off the bat that's on my mind is can you walk us through your journey with autism spectrum disorder diagnosis, and what protocols, what treatments have you tried along the journey, and what brought you to BioNexus Health, knowing that we are a completely herbal-based, plant-based medicine option. So if you can just give us, doesn't have to be step by step, just kind of tell us about your journey. That would be awesome.
Okay. Well, it was about the age of 3 when our daughter was diagnosed on the spectrum. So it just obviously completely, it changed our world. We're like, oh my gosh, what do we do? What's going on? And so at the time, we were connected with our local pediatrician, local doctors, and local speech therapists, developmental therapists. And so we just honestly, we didn't know anything different. We weren't educated in this area. So we just did what we were told. What they told us to do, we did it. How high they told us to jump, we did it. I mean, we just followed exactly what they told us to do because we didn't know anything else. So they gave us hope that, within a couple of years or so, being in, getting all the therapies, she would be caught up and be back to where she needed to be. And then we started hitting the kindergarten age and things weren't really catching up. And we're like, what's going on? We did everything he told us to do. It's not working. So around the age of 5 or 6, we started seeing a damn doctor. And we had to travel to Southern California to see him. And so we followed his protocol. And it was good. However, there weren't significant changes, to be honest. There wasn't anything really monumental that we're like, gosh, this is really working. This is getting her caught up. And then we were doing everything. We changed her diet, but it was more just gluten-free and dairy-free is all we really did. And then just a bunch of supplements. And I would say maybe it helped a little bit, but not enough for all the work and effort that we were doing. And cost-wise, of course. It just wasn't outweighing everything that we were doing for her. And it was very, as a parent, as a mom, I mean, it's a lot. It's just a lot to take on. And I couldn't wrap my brain around those. Like, God, this is working. So we kind of took a step back from seeing him, and I just continued doing, healthy cooking for her, and just doing the therapies that were recommended. And again, we kind of hit another plateau of like, gosh, there's no movement. There's not a big jump in progress here. So around a few years ago, I really dove back into it and listened to as many podcasts and talks as I could get my hands on. And It was a little overwhelming, but I just dove in 100%. And I came across a podcast with Karen. Gosh, I can't remember her last
Oh,
name.
yes.
Karen.
Yeah.
Anyway, you were one of the guests on that talk. And it just really struck me. I was like, oh my gosh, I could really connect with this woman just as a mom. And just knowing your education, your background, and knowing that you recovered your son, it just gave us just tremendous hope. I just like sparked up a light again. I'm like, okay, let's do this. Let's do this. She's still young, where we can hopefully, get her back and get her to be the best, she can be. So we started seeing you. However, just shortly before we started with you, I had seen a local nutritionist, and she really talked to me about about nutrition, the nutrition piece. So I had that little bit of in place. So she's been on a really good, healthy, grain-free, no processed, no sugar, none of that stuff. Gosh, for at least 5 years. And that in itself has been an overtaking, it's been a huge, huge change. But when we started doing that, we started seeing a little bit more of a difference. And then we started working with you, progress started moving forward.
Okay.
I really just wanted a natural approach, to be honest. I was done. I wasn't going to put on any medication, nothing, not natural. Everything that I've wanted to do for my daughters, both of them. And just for us as a lifestyle, we go the natural approach. Of course, we're thankful and blessed that we have Western medicine when needed. But I think that trying the natural approach is the first way to go.
I see those many bottles of the beautiful essential oils right behind you, right next to the apples. Right?
Yes. Yes. Yeah. Essential oils. I've been using those also, like 5 or 6 years.
Okay.
And, they smell great. They're
Yes.
calming. And so I use a lot of them on my daughter as well, on both of them.
Yes, essential oils. I talk about essential oils in my lectures a lot, that when combined with certain herbals, they can give us, a jump up when we are trying to recover our kids. So yeah, it definitely, it was a 7.5-year journey of discovery for myself, because we, as you must have heard from my various podcasts, we went to so many different practitioners all around the world, and each one gave us like one nugget of information, which kind of helped us move a little bit forward. And towards the end, I found that I had to come up with my own plant-based protocol, to the point of actually making my own formulas, and having a biodynamic farm, just to get that farm freshness with the herbals, knowing where my herbs come from. And so yes, whatever herbs I share with you and my other patients have been tried and tested, and successfully tested by either myself or Brian. So that's where the herbs come from. So I want to ask you, did you start to see any changes when we first started the herbals? Was there a whole different perspective that you were introduced to, looking at underlying causes, looking at mold toxins? Can you tell us a little bit about that?
Oh gosh, I think we've learned a lot from you through this journey. I mean, I feel like we've been working with you maybe, 3 or 4 years now, 3 years or so. And you taught us a lot. I mean, from microtoxins to just toxins in the air, all these factors that play a role in our health that we're not aware of, that you don't see, mold, for example, like just so much. I mean, at times we were a little overwhelmed, like, oh my gosh, could this be contributing? Could, not just to her, but overall everybody's health in our family.
Right.
I would just say that it's just been, we're taking, little by little, we take it one thing at a time, but everything does play a factor in our overall health. And
I think we saw a difference in Lizzie, the diet, and then starting the protocols. She could get a little ornery with her aide, and that went away. And now she's this loving girl, young woman, and just has a beautiful heart and wants to learn, wants to go to school. And, there's still, she's on that cognitive growth, but there's, her health also. That has been a huge, huge, huge turnaround. I mean, her health is 180 degrees from when we started with you.
That's true.
I mean, it was to the point where I didn't think she'd make it to 17. She was in such decline. And then we started the protocols. We got a really good surgeon, and they operated on her sinuses. And the change in her has just been pretty overwhelming. And we're so thankful. You hate to see your child suffer.
Right. And I think for us too, like we didn't know she had all these toxins, microtoxins in her body, the mold, the Lyme. We didn't know any of that. No one had ever addressed or spoken of that. So when we went you and you picked it up on the first talk with us, and just by looking at some of the tests that were done 3 years ago, and we're like, oh my gosh, how did these doctors miss it? And so once those started to get addressed, I mean, it was a slow process, and I think that's the one thing that every parent wishes would go faster. And I understand it's a process, and it's still a process. We're still in it. But little by little, it was addressing one thing at a time with her, and not going too fast. I know parents want a faster recovery, but just going slow and taking your protocol and doing one thing at a time and addressing it. It was easier, and there wasn't so much like side. Yeah, exactly.
Right.
Yeah. When you're your protocol is like introduce one thing at a time, or drops at a time. Every other day, add another drop, and finally we get to the full dosage, and it's better versus going, full throttle. Because I think there was a couple times I did not realizing it, and I remember she was just, it was a little overwhelming for her body, and I'm like, oh no, I think we accidentally, went a little too fast on this one. But overall, her health, like Mike has said, is just a huge difference. And that's the beginning, I mean, kids have to feel well. Everybody has to feel well before they can really start learning. So
yeah, it's my sister's daughter is on the spectrum, and they do straight Western medicine. And she hurts herself, and it's really sad. But it's such what a comparison between, and they're the same age.
Mm-hmm. The same age as well?
Yeah, a month apart.
Okay.
And she doesn't change her diet or anything. There are no, only medication.
Right.
And to see the difference between Lizzie and McKenna, it's night and day.
Night and day. Yeah, you're right. I mean, I've heard from mothers in many countries, moms and dads from many different countries, that around the world, between 2 and 4 psychiatric medications for children diagnosed with autism spectrum disorders is pretty routine. One is for behavior, one is for sleep, one is for mood, one is for aggression. And they don't really achieve any kind of cognitive improvements. There's no academic learning. They just keep moving from one class to another. In fact, I forget which country, but one mom told me that her son is in 4th grade, and all they do in school is coloring. That's all they do. So it ends up being glorified babysitting service at that point, just so that the parents can catch a break, when the child goes to school. And that's actually why I have been requested to do these podcast series, to bring awareness to families that it's important to look deeper. I mean, we here in the United States, where medicine is supposed to be way ahead, and cutting edge discoveries happening every day. It took us a very long time, for myself as well. And we ended up with my son having 11 co-infections. Many had crossed the blood-brain barrier, mold exposure, chronic inflammation. So when you have all of these things going on in the body and the brain, sometimes autism can be a symptom of all of these underlying issues, which is what I think you guys came to realize as well.
Oh yeah, definitely.
Yeah. Can you talk a little bit about your daughter's cognitive gains? How did she change in school, academic, learning wise, concentration, focus? Is she at grade level now, more or less?
Yeah, so when she was, she completed 1st grade, like I said, this is before anything. So just following everything what local doctors were recommending, therapists, whatnot. At the end of 1st grade, she was just not making any gains. He actually recommended and talked us into putting her into a, here it's called strategies class. So basically, it's like you said, it's glorified babysitting, and we didn't really know that. We just, again, followed their lead. They said this was a good program for her, and we trusted. And we didn't know any better, any different. She's our first daughter, first child, and so again, we're like, okay, they're the professionals. We know they know what they're doing. They know what they're suggesting is probably the best thing for her. So we went ahead, we moved her to a different school. She went into this program, and that's what it was. And so she was in that program for about a year and a half. So her full 2nd grade, and then most of 3rd grade. And about halfway through the school year, we were like, what is going on? Why isn't she learning?
No education.
There was no education going on. And, I'd see what she was coming home with, and it was just
garbage.
It was just nonsense. I'm like, what is she learning in school? And so that's when we really started asking questions. And I would have to say the biggest thing that helped us, and I would recommend to any parent, is getting an advocate that knows what they're doing. They know what to ask. They know the school system. They know the education. Because as parents, you really don't. I mean, you trust the school system. And that's not the right approach for everybody. So we got a fantastic advocate, and she went in and she asked all the questions for us in a very nice way, but she got the point across. And slowly we started changing things, and we got her into back into general ed by the end of 3rd grade. I mean, it was only the last 2 months, I think, of the school year, not the full quarter, but they're like, wow, she really can do this. She just needs a little assistance, a little bit of modification. She can't maybe do the work as quick as a typical peers, but she is capable. And that was it. I was like, okay, here we go. Let's go. Let's get her back in. And so she was back into general ed full time. She did have an aide. So that was 3rd grade. So fourth on, we just pushed forward and kept going. And she's progressing, and she's really made a turnaround. Once we implemented, first was the diet change, the radical diet change. That definitely, helped her calm down. And once we started the protocol, things started moving along a little quicker. And overall, the thing is, she's very capable. She's a smart girl. She can get around work, and I think that's kind of where some of the behaviors were. She would act out, and so she'd be removed and not have to do the work because of course it was hard. So she was a smart cookie, and that's when we realized, you know what? No, we're gonna do this, and you're gonna do this, and this is what it is. But then it just kind of shifted when we started the protocol. She enjoyed being in class with her peers, and she wants to keep up with them, and she tries so dang hard, and some things are obviously still a little hard for her. So now she is in middle school. She just completed 7th grade. She does still have an aide. However, she only has her for the academic pieces. Everything else she does 100% on her own. She has friends at school. Yeah, she's really caught on. All her classes, she does all the general ed work. Some stuff is modified a little bit for her, like fewer problems, not the full page. Her reading is great. Her comprehension is still a work in progress, and that's what we're addressing right now with the protocol. But
I've got over 3 fun.
Yeah, I mean, she loves school. She loves to learn, and she gives it her all. And she honestly just wants to just be with her peers and be a typical kid and laugh and socialize. And that's the one thing she's always loved school and being social. It's that social piece that's still a little awkward at times, but she has a few good friends at school that love her and accept her as she is, and she just wants to be with everybody else. So
yeah. See, those are the things that every parent wants to hear. Sorry, I just have a tickle in my throat. But those are the things that when we first started on the journey as well, you don't know what the future holds, whether they will get a good education, will they be independent in life? Now I have my son living independently, attending college, and when he was all those years ago so weak, with his left leg paralyzed in a wheelchair, it was difficult to imagine this day. And he was barely verbal. But like you mentioned with Lizzie, we've she's in general ed, no behaviors, has friends, is able to socialize, needs an aide only part of the time. Amazing.
Yeah, it's a big difference. Yeah.
Her overall health has improved, right? Her immune system, her coughs and colds.
Yeah, her immune system is very, very strong. She had a sinus infection, as you're aware, for quite a few years, but she's grown now since the surgery over an inch, and her health has, I can't believe, and like we had a leak in our refrigerator in our water filter, and the entire downstairs closet under the stairwell was black. So I went to dry it out, so I put fans in there, and then when the remediation people came, they're like, no, you just flooded your house
with mold.
With mold. And so, we went through that whole thing, got, a team out here, they cleaned everything.
Mhm.
and they sampled before and after, and the house is clean. But you were able to catch that we all had mold infection and mold toxicity, and being able to address that. And you never know.
Right.
Don't know. My wife always tells me, how full is your bucket? You know, eventually everybody's bucket fills up.
Mhm.
Bucket's full. So when she gets exposed to these things, her body reacts. But I think she doesn't get the flu. She does not get sick like she used to. She has a very, very strong immunity, strong constitution. And, a lot of it's these supplements that she's taking, that they really do help her.
It's very interesting for people. It can often be eye-opening when they hear that completely plant-based treatment can bring such a turnaround in a child diagnosed with autism. It's all natural, right? Herbal medicine. So I'm glad you are highlighting that aspect. That we don't have to go with toxic medications, toxic psychiatric drugs that are sometimes prescribed, and then more drugs are prescribed for the side effect of those.
Yeah, absolutely. I think it's a shame that so many kids, I mean, people in general, but since we're talking about children, the first go-to is medication.
Medication, right?
It is. It totally is. I mean, she was very, very young when she was very little. Her illnesses were a lot of ear infections, sinus infections. I mean, I would say probably the first 3 years of her life, she basically lived on antibiotics.
From 3 months old.
Yeah, it was, and we didn't know any difference. So we just said, okay.
Right.
And finally I got to the point one day I said, no more. Like, why is she getting this? Like, let's get to the root of it. And that was the hard part, is that no one could figure it out. They're just like, oh, it's just her cilia, it's not working, or it's just this. And
Right.
I literally picked her up. We were in the doctor's office. He wanted to give her another antibiotic. I picked her up. I walked out of the doctor's office. I said, no, not until you know exactly what she has going on. We will not give her another antibiotic. And that was it. So I just came home and I just rubbed her all over with essential oils and whatever I can get my hands on that was natural.
Good.
But we did. She did get some titanium tubes put in, but we got a pediatrician who was willing to work with us on the natural side of things. She had Pandas for 10 years.
Yes.
10 years. We walk into her pulmonologist at the hospital and, have you heard of Pandas? No. What do you mean? No, you are the chief pediatric pulmonologist at a children's hospital. But the medical student, she had heard of it.
Mm-hmm.
So, but my wife always tells me we have to be her advocate.
Advocates, right?
Because if we're not, the system will just throw her away.
Yes.
That's the way it's set up.
Yes.
And a big thing, sinus rinses. That's what we have to do twice a day. And before her surgery, her pulmonologist and ENT out here in Reno were like, you don't need to do, what is that going to accomplish? Then we went to Stanford. They did the surgery.
Mm-hmm.
Her pulmonologist and her ENT at Stanford understood that she had Pandas. So we got it all cleared out and we started your protocol for that. And now the people out here are like, yeah, do those nasal rinses. But it's like, if we didn't look into it or we didn't push.
Mhm.
You know, you were saying there has to be a reason why this infection is not going away.
Right.
And her left sinus, I mean, her sinuses were impacted
Mhm.
by almost 100%. Quarter-sized polyps, mucus that had turned to rubber cement, and you know, a 45-minute surgery wound up being 3 hours and 15 minutes.
Wow. Right.
Yeah, just to clean it out.
Mhm.
You know, praise God, she's cleaned out. She's, you know, she doesn't have that fog
Mhm.
that, you know, and now we can, you know, the Pandas is gone away.
Huge trigger, yes, to have strep infections in the sinuses. Staph, you know, she had Marcons as well. So I can hear an echo somehow. Is that a speaker on?
No,
No, okay, it's okay. I think it's clear enough. But you know, it's kind of mind-boggling for most of us parents when we first, you know, remember when I first ran all the labs for you and we found all of these triggers for PANS and PANDAS, all of these Lyme and co-infections and mold. It was just all these infections in one little person, you know, and they just label our kids as on the spectrum, and that's the end of that.
yeah.
Yeah,
Oh, absolutely. Yeah. Look for any underlying issues at all. And again, had we not met you, we would know none of this. We wouldn't, you know, and that just goes back to what Mike said is that, you know, every parent, you have to be your kid's best advocate. You know, ask questions, ask the hard questions. I'm sorry if you know, if they may not take it right, you know, but not every medical professional knows. I think that's the
hard
that's the
part.
hard part is that they don't have that piece in their education is the natural approaches, the food approaches. I mean, it all factors in. You know, their go-to is just medication. And like I said, I think there's a time and a place for it, but this is a better one.
Yes. I mean, with mold exposure comes Marcons, and then comes lowered immunity in the sinuses. That's how these opportunistic infections like strep, they hang around there forever. And it's when you see conventional treatments, it just seems to be the same thing, you know, nebulizers, inhaled steroids and what have you. And many kids are on those for years without ever knowing, oh, it's asthma, oh, it's sleep apnea. Now, did Lizzie's gut improve on the herbal protocol?
Yes. And that's, I would say, a huge thing for her because of so many years of antibiotic use. I feel like that really messed her up. And again, we were not educated. We didn't know how big of a role probiotics play in a child. And so those
starting in the gut.
Everything starts in the gut. And so now, you know, we're still addressing that, but I feel it's gone tremendously better. You know, it really has. Yeah.
And we, you know, very rarely did she take an antibiotic. And I mean, it's to the point we won't let her take an oral. So, I mean, if she's sick enough for them to prescribe an antibiotic, we start looking at the whole schedule. Like they wanted to put her on Levaquin. Wow. And that will kill her. That will smoke her kidneys. And it's a very powerful drug. And I'm like, so we wound up going with cefamine and tobramycin, but they were intravenously done, and then tobramycin was nebulized. But you know, it's just another part. Like you have to hate me. I mean, when I go in there and I'm asking all these questions, And, you know, her ENT's like, you didn't go to med school. And I'm like, no, but I can read. There's the internet, you know, and I see what's going on with my daughter, and her naturopath, her doctor is saying, we need to do X, Y, Z. So, and, you know, and her doctors at Stanford have the entire rundown on you, and they are like, wow, okay, yeah, everything she's doing is spot on. So, you know, and
That's good.
yeah, so, I mean, you have made such a difference in my daughter, my wife, my life, our family.
Absolutely.
Because, you know, it's just not my daughter getting better, it's the family getting better. But yeah, you have to look into this stuff. If you don't, and you trust somebody else, it's just, nobody's going to care for your child like you will.
Very well said. Yes. So you're saying that your doctor at Stanford knows all about my protocol, everything that Lizzie is on, and he's okay with that.
Oh, 100%.
He's the surgeon.
Yeah.
He is,
Okay.
yeah, the pulmonologist and the ENT and the immunologist. I mean, they looked at who you are.
Oh, okay.
They looked at her protocol.
Yeah.
Okay.
One thing that they did say is Lizzie's blood work was really, really good. She was sick. I mean, this is back in February, and they're like, we need to get this sinus infection dealt with. And it's causing Pandas. And they were aware of that, but they said by the time that they see children like Lizzie that are that sick, they look at their blood work and it's a disaster. I mean, and they're like, we get this taken care of. Her, she's really healthy. Her blood work looked really good. And, you know, again, that's because of your protocols. And the doctors, you know, they approve of you.
Oh, that's wonderful to hear. I mean, you know, not the approval, but it's wonderful to hear that high-profile conventional medicine doctors are acknowledging herbal medicine. That's the part that's important, you know, because many children that are on the spectrum have so many underlying issues that may need surgical procedures. And oftentimes after any procedure, you know, kids with PANS, PANDAS, and autism, any minor dental procedure and they crash. So in order to be able to build up their body, clean out these infections from within so that the blood work is okay enough for these necessary procedures to be carried out. Like, you know, for Lizzie, like you mentioned, this sinus surgery was extremely important. And you know, she went through it without a glitch. So actually, if I may, Michael, if I can ask you guys, and Maria, of course, if I can ask you guys to summarize Lizzie and your family, if you will, prior to herbal protocol and after the herbal protocol. If you could briefly summarize, what would you say?
Okay. Well, yeah, I would say that definitely start with your find a good doctor. But you do have to have a good general doctor. We have a fantastic pediatrician that is very open to natural medicine and to herbs, and because there are some things, you know, she helped us get the labs done that you requested. That was definitely the first one. And just overall, start with your natural approach. Like I said, there's a time and a place for Western medicine, and we're blessed and we're thankful that we have it. But overall, I believe that our bodies can heal with herbs, with natural herbs, and they have made a huge, tremendous difference. It is a slow progress. It's not something that's going to happen overnight. So parents and the whole family does need to be patient and take it, one step at a time. But overall, if I can go back in time, I would have started 100% with the herbs and natural approach, 100%.
When she was,
It has made a tremendous difference in her and our family. As I said, we've done some of the approaches, protocols for our other family as well, our daughter and Michael and myself, and it's just a big difference in our health, and with no side effects. With medications, there's always going to be side effects. That's just the way it is, unfortunately. But overall, we're very pleased. We're very happy with the way Lizzie's progressing with our natural approach of the herbs and the protocol that you have her on. And we just keep moving forward.
Yeah.
Mm-hmm.
I think before we met you, Lizzie was definitely on the decline. Our first scan doctor, he was pretty good, but it was very kind of disorganized would be a good word. I mean, he's a great doctor, but it just, not everything was together. And when we came to you and you're like, okay, this is what Lizzie has, and this is how we need to address it. We started addressing these things, and we started to see a change in her. And then, it kind of culminated this past February with her surgery, and the removal, that trigger for Pandas. So now, she feels so much better. She's so much healthier, and she started growing again,
Yes, that's the best part. She started growing again. That's wonderful. Maria, if I may, you mentioned about having a local naturopath, pediatrician. So yes, practitioners, holistic practitioners like myself, we are able to order other kinds of labs like urine, stool, nasal swab, saliva, etc., blood spot. But sometimes blood work is needed when a child has pretty severe infections to have a look at the liver and the kidneys function as well as Dr. Shoemaker's labs for mold-related inflammation are important to decide dosages of key supplements. So that's when, having a pediatrician or a primary care that can empathize with us is a big plus. It's not 100% necessary, but yes, it's very helpful.
Yeah, absolutely. Mm-hmm.
I would like to thank you here from the bottom of my heart for coming here and sharing your story today. And I'm sure it is going to inspire, motivate, and benefit so many parents of children on the spectrum from around the world.
Thank you for joining Master Herbalist Dr. Jody A. Dashaw, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.